When you think of saving lives, what do you think of? Ambulance? Hospital? Surgeons? You should be thinking of you. Studies have shown that it's not emergency personnel saving lives. It's recognizing and acting when a cardiac event occurs. You, as a bystander, a regular person, will save lives. Hi, my name is Annie, and I'd like to give you some basic instructions today on CPR and AED use. I highly recommend a full course and hope today that I can inspire and empower you to dare to care. Hands-on CPR is being taught by the layman or to regular person. Research shows that more people are more willing to help if you don't have to kiss a stranger. If you took all the cells inside your lungs and you laid them out, it would cover an entire tennis court. That much surface area makes the exchange of oxygen so much easier. Most people say that a brain cell can live for 6 minutes without oxygen, which is incorrect. Without oxygen, a brain cell will die, but your blood can hold oxygen for up to 6 minutes. This is where CPR is critical. The brain needs that oxygenated blood in order to survive. You can make that happen if you know how and when to keep that heart pumping blood. First, we'll always make sure you're in a safe area. You don't want to create another patient by going into a dangerous situation. Next, we're going to check for responsiveness. Simply asking, "Are you okay?" and shaking an unresponsive person is enough. If you can tell someone to call 911 and find an AED, always point at the person. Use their name if you have it. In emergencies, people can assume that if you yell 911, that someone else is going to do it. To assure you're getting the help you need, give a task to an individual person. Check for a pulse. Best place to check the pulse is in the neck, between your windpipe and that large muscle. If you feel a pulse, do not delay, begin CPR. If the person says stop, you're going to stop. But if not, please continue. Bare the chest if possible. You're going to be looking for any medication patches, and if you don't have gloves, do not touch medication patches. You're going to kneel next to the side of the person, placing your hands in the middle of the chest. You put your other hand over and lock your elbows, using your body as the pivot. Push hard and fast. Hard, the compressions need to go at least 2 inches or 1/3 the depth of that person's chest. Fast, at least 100 to 120 beats per minute. This is so much faster than you think it is, and that's why I highly recommend a full class to maximize your knowledge. Allow the chest to recoil. That just means make sure it comes up so that you can allow that heart to fill with blood. If you're able to get an AED, first thing first, you're going to be turning it on. Most AEDs will talk you through it. All you have to do is follow the prompts and/or pictures. There are only two rhythms an AED will shock. There's two that are VFib, VTAC. These both originate in the bigger, strongest part of your heart, which is lower, which is called the ventricles. I find the best way to illustrate these two rhythms is to compare it to a marching band. If you've ever watched a marching band and they're in step and moving together, it is beautiful. The VTAC is when the members of your band decide that they're marching way too slow and they just start running. Still in step, keeping rhythm, just too fast for the music and these instruments. An AED will send out an electrical pulse in the form of the pads across the heart, stopping that band in hopes that they're going to start up in a regular marching rhythm. The second rhythm is VFib. This rhythm is the marching band sections going their own way. Trumpets this way, clarinets over there, no organization, everyone playing maybe a different song. The AED is stopping the band in hopes that it's going to start up again and perform that rhythm, which is the heart stopping and restarting to keep that person alive. I hope by watching this video today, I've inspired you and empowered you to be able to get out there and take an CPR class. Classes can be found online at the American Heart Association and the American Red Cross, because I want you to dare to care, because you too can save a life.